This is part 2 of my conversation with Dr. Tony Attwood at the AEP conference in the Wisconsin Dells. The next question is from Gabby, and this is a concern. Gabby writes, I get quite a lot of rage attacks. Rage attacks for me consist of getting angry at myself and very irritable, where I smash my room up and I hit my head and I punch my arms and I say I want to kill myself. The rage attacks are getting worse. I have 7 incidences of self-harming by cutting my arms. Sometimes I do it to ease my emotional pain, and sometimes I do it just to feel alive. I am scared that one day I'm going to do something stupid. What would you say to Gabby?
Well, yeah, you could have an accident and you could cut something that is serious. So when you get these rage attacks, please tell someone. They may not be able to help you, but they can be with you. I wouldn't ask them to talk to you or do anything, but just be there. To be supportive emotionally, but not intrusive. So that if an accident occurs, then they can quickly get medical help, paramedic, to deal with that injury. But the question is, the rage attacks, why? Again, they're quite common, and the intensity is unbearable, and the self-injury can be for a variety of reasons, and you've explained this perfectly, of sometimes I do it to feel alive, to actually get some feeling, some recognition of yourself, or to ease the emotional pain by something else that's more painful, that blocks the other emotional pain in your life. Mm-hmm. So it's become a coping mechanism for self-perception, emotional experiences and so on. You really need to talk to somebody about this. Somebody who understands about the issue of depression, self-esteem, etc. So that identify the triggers of what can provoke a rage attack, knowing when they're on their way, and having an emergency procedure of when they occur to live through it, to go through it, and then recover afterwards. But really, Gabby, it would be very important to talk to someone about these rage attacks, what's going through your mind at the time. It can be a depression attack. The rage can be misinterpreted as anger when in fact it's depression and a depression attack, and people need to understand it, that the person isn't necessarily aggressive, it's basically an intense emotion that's coming out. Now, I don't know of a medication that will quickly resolve these, because they come in quickly, they're very intense, sometimes too quick for any medication to work. So it's really having a plan. When one's on its way, emergency situation is like going to have a seizure. I've got to do something about it. It's like telling somebody, I'm going to have a seizure, I'm going to have a seizure, watch out, fall to the floor and shake. And somebody's with you to check that you're okay till you come out of the seizure.
That makes sense. The next question is from Kieran. Kieran writes, I'm the mother of a 5-year-old boy with Asperger's. My son gets angry and frustrated easily and has trouble with emotional management. If a teacher asks him to write, he interprets it as, the teacher is mean, she makes us work hard. If we ask him to hurry up and get ready for school, he interprets it as, you tell me to do everything, you think you are my boss. Trying to help with the right interpretation can lead to a tantrum. I understand cognitive behavior therapy can help resolve this, but he may be too young for that. Please let me know if you have any advice.
I wouldn't recommend CBT. I'd recommend Carol Gray's Social Stories and Comic Strip Conversations. Social stories to explain why the teacher asks him to do things that are difficult, to make him more intelligent and more successful. Comic strip conversations, where you draw the situation with stick figures and speech and thought bubbles. So he writes or says in the thought bubble what he thinks the teacher is thinking, and then say, actually, let's find out what she was really thinking. And then she writes in, I was actually thinking this, which then makes the world more logical. So I would look at social stories to explain the logic of why he's being asked to do things, and comic strip conversations and speech and thought bubbles to actually give him insight into the thoughts and feelings of others. He's projecting onto others motives that they don't have, but he doesn't know how to read the real motives.
Great way to get into a conversation. The next question is from Rock Jericho, and he writes, Dr. Tony, we have your book on anxiety, and we feel strongly that such therapy is needed for our kids. However, we live in an isolated area where there's limited access to professionals who are trained in cognitive behavioral therapy in children on the spectrum. Do you have any other ideas on how we can access this help? Have you ever heard of parents doing a group using your anxiety resource or other resources to work on this as laypersons?
Brilliant. do it. All I can say is, when I wrote that anxiety book, Exploring Feelings, CBT for Anxiety, I didn't write it to be exclusively used by clinical psychologists. Interestingly, the university that did the original evaluation subsequently did a study of parents using the book, but without a psychologist, and it was just as good.
Excellent.
Shh, don't tell psychologists that. I think parents know their kids.
Yeah.
Parents aren't stupid. Parents have a reasonably good idea of what to do. I don't think if you're being a parent, you're then barred from using the programs. They're logical, they're common sense. It would be great if you had a clinical psychologist, but if you haven't, this is too important to abandon. As laypersons, you are not excluded from the ability to use programs. And if you haven't got the resources, do it.
Excellent. The last question is from Ms. Tiggykins, and she writes, I have post-traumatic stress disorder, and I get depressed at times. Several people have suggested I may have a type of bipolar or borderline personality disorder on top of my ASD. What would that look like in a person with ASD? Whereas I enjoy solitude and find social situations exhausting, the women I know with BPD are very engrossed in an emotional world that focuses around people and relationships, and they have an overwhelming fear of abandonment. I can see where superficially some of the symptoms of BPD and ASD may appear similar, but the personal meaning, significance of these behaviors are really very different. How would I go about getting a clear diagnosis?
Another good question, and I see a number of women diagnosed or misdiagnosed with borderline personality disorder. They're not mutually exclusive. In borderline personality disorder, there can be an overreaction to a slight, an error, something that emotional that occurs on an interpersonal basis. An intense depression attack occurs. I'm going to kill myself, I'm going to split my wrist and so on. We had a moment ago a rage attack described. The same can occur with a depression attack. So the person with Asperger's may catastrophize an event. It's part of the problem in emotion regulation, and that negative emotion has a catastrophic overreaction that the person finds difficult to control. Now, one of the things of borderline personality disorder is the person is assumed to be, and can be, usually very good at reading facial expressions and body language, and then misinterpreting people's intentions. And the view of autism spectrum disorders is they're not, as we had earlier, very good at reading body language and so on. I will challenge that, because my personal experience clinically and in autobiographies is that some with Asperger's have a sixth sense for sensing negative atmosphere. They're not doing it by facial expressions, they're not doing it by tone of voice, but they just feel there's something wrong here. I just feel it. I just don't know what it is. They walk into a room, there's something going on here. And so they may use a sixth sense, another channel, to determine negative affect, negative emotions, and then react accordingly. Now, certainly there can be strong fears of rejection and abandonment in Asperger's, because that has happened. In their friendships, when their friendships end, they often say, my friend was disloyal. I was a good friend, why did they abandon me and go to someone else? So there can be a history of that occurring with a person with Asperger's, and you're dealing here often with women who will react in a different way to men. So borderline personality disorder can occur in those with autism spectrum disorders, especially the women.
Interesting. Dr. Tony, that's all our questions for this month. I thank you for taking the time after your busy day to answer these questions. I also want to thank you folks at Autism Hangout for submitting these questions, because this is such an unusual opportunity to hear from one of the world's leading experts about the issues that are relevant in your daily life. So thank you, Dr. Tony. Thank you for this session of Ask Dr. Tony.
Thank you, Craig.
And thank you, Autism Hangout. I'll be back again soon with another special report.